Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering maternity, and to be specific, we're going to be going over labor and delivery. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give me a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already, and be sure to check out my website, nexusnursinginstitute.com. Guys, listen. My website is the only place that you can get the NCLEX RN cheat sheets. Nowhere else. There are so many scammers out there. I've made multiple police reports. I've gotten these pages shut down, but they seem to reappear and pop up faster than I can get them shut down. Okay. Please do not get scammed. Anyone telling you that you can get your book anywhere else then my website, Nexus Nursing Institute, is lying to you. They're going to take your money and you're never going to hear from them again. The only place you can get that book is on my website, nexusnursinginstitute.com. Speaking of my website, let's say you're not studying for your boards, you're not in your last semester of the nursing program. You don't need those cheat sheets. That's fine. I've got audio lessons. If you're currently in the program and you are struggling, you have to do really, really well on your next exam. Check out my audio lessons. You can find those on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Now, without any further ado, guys, let's get started. Okay, maternity, specifically labor and delivery. More labor. Okay, so this stage of labor lasts from the time the cervix is fully dilated to the birth of the fetus. Which stage are we talking about? Is it the first? Is it the second? Is it the third? Or is it the fourth? From the time the cervix is fully dilated to the birth of the fetus. What do you guys say? If you're not on the Kahoot, that's fine. You can type your answer on the live. You can still participate. What do you think the answer is? The question says this stage of labor lasts from the time the cervix is fully dilated to the birth of the fetus. Okay, only 14 of you guys got the correct answer. This is the second stage of labor. If you are taking maternity, you absolutely need to know all of them, guys. All of them. So, number one, which one's the first one? The first one starts with regular contractions. So, it starts with regular contractions and it ends with full dilation. Guys, what is full dilation? How many centimeters is full dilation? Quickly. Anyone? Thank you. Thank you. 10. Okay, so that's your first stage. Then, of course, we have the second stage, which again, it's from that full dilation to birth of the fetus. What's the third stage? It starts at birth of the fetus to delivery of the placenta. And then the fourth one is delivery of the placenta to about 2 hours after birth. You have to know all four. Don't say I didn't warn you. All right, next question. What is it called when the fetal head passes the pelvic inlet? Is it engagement? Is it descent? Is it flexion? Or is it internal rotation? Again, what is it called when the fetal head passes the pelvic inlet? Engagement, descent, flexion, or internal rotation? No, effacement is when it thins out. So dilation is how wide it gets, and effacement is how thin it gets. Okay, there's a difference. Okay, very good, guys. The correct answer is engagement. Engagement is when that fetal head passes the pelvic inlet. Something else you guys have to know about engagement, this happens much sooner with women who are nulliparous, women who's never given birth before. And the reason for that, their abdominal muscles are still very strong, like they haven't been stretched, so they're much stronger, and so they push that fetus down. Okay, so this happens faster in nulliparous women, where nulliparous women will experience this before active labor begins normally. Okay. So now let's talk about the other options because you guys have to know what those are as well. Descent is the actual progression of that fetus going through the pelvic canal. Flexion is as that fetus comes against resistance, what the fetus is going to do is kind of tuck the chin down, and that's that flexion. And then internal rotation for that fetus to completely come out of the birth canal, it will turn the head, and so that internal rotation is really the turning of the head, the rotating of the head, so the fetus can exit. Okay. Okay, true or false? During the second stage of labor, the nurse should encourage the patient to perform the Valsalva maneuver when pushing. Is this true or is this false? I'll repeat that question again. During the second stage of labor, the nurse should encourage the patient to perform the Valsalva maneuver when pushing. Is this true or is this false? You guys are killing me on this live. It's false, guys. Everybody on the live was saying true, true, true. Are you kidding me? So let's talk about Valsalva maneuver. The Valsalva maneuver, guys, is when like you hold your breath and you tighten your abdominal muscles. Why is this a bad idea? Why should the patient not be doing this when they're pushing? I'm so glad you asked. The reason we don't want them to do that, it increases intrathoracic pressure. Okay. It decreases venous return. It decreases oxygen to the fetus. So you're going to mess around and cause fetal hypoxia. Is that a good idea? Absolutely not. Okay. So we don't want the patient performing the Valsalva maneuver when they're pushing. That is false. Okay. Which is or are not maternal physiological changes during labor? Which is not or which are not maternal physiological changes during labor? Select all that apply. Here are your options. The cardiac output increases, heart rate increases, blood pressure increases, respiratory rate increases, blood temperature, increases, blood glucose level increases. So we know there are many physiological changes during labor. We know that. But which ones are not? Which one or which ones are not physiological changes during labor? Again, here are your options. Cardiac output increases, heart rate increases, blood pressure increases, respiratory rate increases, temperature increases, blood glucose level increases. Allah, I love this for you. The only one that is not a physiological change, guys, is blood glucose level. I want you to think about it. There's a reason this is called labor because they're working. They're working very hard. When you're working hard and you're exercising, is your blood sugar going to go up or it's going to go down? It's going to go down. Your body's using that glucose for energy. So, a patient that's in labor, they're working, their blood sugar is going to do what? Go down. Duh. Right? They're working. But everything else we expect to see, just like we would expect to see if you were working hard. Cardiac output increasing, heart rate increasing, blood pressure increasing, respirations. What happens when you're working? You're moving a whole lot. Don't you get hot? Yes, even your temperature can go up if you're doing it the right way, right? So the only one that we do not expect to increase is going to be the glucose. If anything, we expect that glucose to go down. Okay? True or false? Early deceleration is considered to be benign. Is this true or is this false? And make look at this picture, make sure you can recognize or look at it, maybe it can give you a hint. Make sure you can recognize what's happening here. True or false, guys? Very good. True. Early deceleration is benign. It's not harmful. Usually it's, happens from fetal head compression, from like contraction or like a vaginal exam, right? So what happens is you'll see the fetal heart rate slowly go down. And when I say slowly, it's going to be 30 seconds or more. Slowly go down, but return to baseline. Here's the thing though, it's going to mirror the contraction. So as the contraction begins, you see it slowly go down, and then the contraction gets strong, and then it's at its lowest, and then the contraction, those muscles start to relax, and the contraction goes down, and then you'll see it go back to baseline, right? It mirrors the contraction. So, and this happens, by the way, guys, this happens because of vagal nerve stimulation. Because normally, if the fetal heads, well, no, I can't say that too because that's actually another question. I don't want to give you the answer. But the point is, here's the point. If it's early decelerations, we're okay with that. We're okay. We're not happy, but we're not sad. It's benign. It's not harmful. Again, a couple things you need to know about early deceleration. It's benign. It's not harmful. You need to remember that it happens slowly. It's going to be 30 seconds or more. You need to know that it mirrors that contraction, and you need to know that usually happens due to fetal head compression from like contraction or vaginal exam. Those are four very important things you need to know. Okay? True or false? Late decelerations are considered to be benign. Is this true or is this false? Again, take a look at this photo. This should mean something to you. What do you guys think? Late decelerations are considered to be benign. True or false? False. Where early decelerations, is benign. Late decelerations, we have a sad face next to it. This is bad. Okay. So with late decelerations, again, we see the fetal heart rate, we see it go down. We see it happen slowly again, 30 seconds or more. Here's the problem. It is not mirroring the contraction. It's mirroring the contraction. Okay, we understand what's happening. This is a vagal response, right? But it's not mirroring the contraction. It's happening after. So imagine something like the head compression is happening, and as the contraction is happening, we're not seeing the fetal heart rate start to go down until afterward. And then when that contraction's at its worst, it's at its peak. When the contraction, look at my hand, guys. You see my hand's going up. The contraction is at its highest. That's its worst. It's squeezing the heck out of that fetus's head, right? That is when we would expect to see the fetal heart rate at the lowest. But no, it's after the peak we see the fetal heart rate at the lowest. This is a late deceleration. This is not good, guys. This is not good. Okay, so no, it's not benign. This, when you see late decelerations, it should be a red flag in your mind. You should say fetal distress. Okay. True or false? Acceleration with fetal movement is considered normal. Is this true or is this false? Did you guys freeze on my screen? Okay, thank you. Acceleration with fetal movement is considered normal. Is this true or is this false? True. Doesn't your heart rate increase when you're moving about? Of course. So acceleration with fetal movement is considered normal. Absolutely. And here's the thing, when we were talking about deceleration, when we were talking about the heart rate going down, for both of those instances, it was happening slowly. Remember, I told you it was 30 seconds or more. With acceleration, which is a good thing we want to see, it happens rapidly, right? Less than 30 seconds. Okay? All right. Select all that applies. What are potential causes of acceleration? Remember, we like acceleration. It's a good thing. But what are potential causes of them? Select all that apply. Here are your options. Spontaneous fetal movement, vaginal exam, fetal scalp stimulation, breech presentation, uterine contractions, fundal pressure. What are the potential causes of acceleration? Again, here are your options. Spontaneous fetal movement, vaginal examination, fetal scalp stimulation, breech presentation, uterine contractions, and fundal pressure. What do you guys think? All of the above. All of the above. All of these can cause acceleration. And with any of these situations, we would expect and welcome the acceleration. That's something we want to see. That's something that we expect. Okay. Select all that apply. Which are symptoms of true labor? Because you have true labor and you have false labor or fake labor. Which one are the clinical manifestations of true labor? Here are your options. Contractions that occur irregularly, excuse me. Contractions that become longer and last, I can't speak. Contractions that become stronger and last longer over time. Contractions that often stop with walking or position change. Contractions that become stronger with walking, contractions that are felt above the umbilicus, and contractions that are felt in the lower back and radiates to the lower abdomen. So which ones, guys, which ones are symptoms of true labor? All the answers on the right. These are signs of true labor. So the contractions get stronger and longer over time. Now, for testing purposes, let me tell you how your teacher is going to word it. They're going to word it as progressive. When you see that word progressive, this is what they're talking about, stronger and longer over time. True labor, nothing is stopping that bad boy. Okay? Contractions become stronger with walking. Yeah, they don't go away, they become stronger. As time goes on, it becomes stronger. And contractions are felt in the lower back and it radiates to the lower abdomen. False labor is on the left. Contractions are irregularly, it's not happening regularly. And they stop once you change your positions or you start walking. And they're felt above the umbilicus. Those are signs of false labor. Okay. Make sure you guys know the difference. Okay, last slide. Select all that apply. Which are signs that suggest the onset of the second stage of labor? Select all that apply. So, what signs suggest that the patient's in the second stage of labor? You guys remember the second stage of labor? Full dilation to birth of the fetus, right? So, what are signs that suggest the onset of the second stage? Here are your options: increase in contractions in frequency and intensity, the urge to defecate, episodes of vomiting, uncontrolled shivering, involuntary bearing down, increased bloody show, which are signs that suggest the onset of the second stage of labor. Increase in contraction frequency and intensity, urge to defecate, episode of vomiting, uncontrolled shivering, involuntary bearing down, and increased bloody show. All of them. All of these are clinical manifestations and symptoms of the onset of the second stage of labor. If you guys are taking maternity right now, please, if you weren't able to take notes, go back once this is posted on YouTube, watch it. Anything that I talked about or that's on the screen that you're not familiar with, study it before your exam. Okay, let's see how you guys did.